The Cutimed Off-Loader Select TCC kit contains components and instructions for making a true total contact cast.
Hello, my name is Carl Lindsay. I'm the Clinical National Trainer in Fracture Management for BSN Medical. I have 24 years of experience in orthopedics. Today we're going to show you how to apply the Cutimed Off-Loader Select Total Contact Cast System. Before we start, let's talk about positioning. If the patient can't sit up or lay on their back, you can apply this cast with the patient lying on their stomach or prone position and position the foot in a neutral position. If the patient can't lay on their stomach, you can position the patient on their back. What we're going to do is also grab a bump to position the leg up high enough to allow me to apply the cast correctly. If the patient is sitting, make sure that the whole back of the knee is free and clear so you can apply the products on the patient's extremity. Before we apply the cast, we want to make sure we establish our dimensions of the cast, how far proximal and how far distal the cast is going to go. The tibia tuberosity is an anatomical landmark to determine how far we're going to go. So just when it diminishes here, that's how far we're going to go on the anterior portion of the extremity. Also on the lateral side, the fibula notch lies here. So what we want to do is make sure that the cast does not go past that point because the peroneal nerve is on the lateral aspect, which it can cause foot drop. As far as for the posterior region of the extremity, we're going to make sure that the cast at a 90-degree angle, as far as the knee is at a 90-degree angle, we're going to make sure that we can get all the way up and the patient can bend their knee 90 degrees. So this is going to be a closed-in toe type of cast. The whole extremity of the foot will be enclosed. To properly apply the stockinette to the patient's extremity, we want to make sure we roll it up to be gentle on the patient to get it across the ankle area. Open it up wide enough so the foot can fit through and just roll it up. To apply the dressings, go ahead and just roll the stockinette back. Get your dressings and cut it to the size of the ulceration that you need to make. Make sure when you apply some type of tape that is not super adhesive, I prefer the paper tape. When you're putting the tape around the toes or any type of dressing around the toes, don't enclose the toes or squeeze the toes. Again, making sure you don't squeeze the toes with the dressing. Now what we're going to do is go ahead and apply the 2x2s. It's going to cushion the bones, okay? Also is going to prevent maceration. We can also use one of our other products, which is Cutimed Sorbact, to go weave between the toes or ribbon form. But for this purpose, we're going to go ahead and just use the 2x2s. Put them in each one of the toes and go ahead and pull the stockinette back down, ensuring that your dressings have not curled up. Now the leftover stockinette that's hanging over, you're going to go ahead and roll that on top of the toes, ensuring that you don't hyperextend the toes. You can go ahead and put your finger there to allow just a little bit of space as you roll it up. It's very important that as we add the adhesive felt, which is going to protect the bony prominences on the tibial crest and also on the malleoli, that the patient is in a 90-degree angle or positioned in neutral position. Go ahead and peel off the adhesive felt. Do not take all of it off because it's going to be extra sticky. Determine your landmarks again, the tibia tuberosity there. Again, make sure the patient's at 90 degrees or in neutral position. Use some of the adhesive felt to tack down the leftover stockinette. Cut the extra off. Ensure the patient's at 90 degrees. Remove any wrinkles that you may see. And go ahead and apply the malleoli pads. Ensure that the malleoli pads do not overlap, which can cause a pressure point. Apply on both sides. The adhesive felt is applied on the bony prominence, and we're complete with that. Next, we're going to apply the perforated foam as a toe box on the toes to allow just for more comfort and allow the toes to move just a little bit. Move the adhesive backing. Apply on the center of the toes. Go ahead and form that around the foot. And as you see, there's an impression there. When you get ready to go ahead and take all the excess off, because it's going to look like a little hammerhead, shark position I would call, you go ahead and start in the proximal portion to ensure you won't cut the toes in the process. Now we're going to go ahead and apply the padding to the patient's extremity. When you apply the padding, this is our Specialist 100, it's a low loft type of padding, meaning it's not extra puffy. It's going to allow you to tear it really easy to go around the extremity. We're going to apply the padding on the foam portion also to make it for an easy removal of the cast at the end of the procedure. This doesn't have to be extra smooth, but just cover the foam. The important part is to apply the padding on the extremity, 2 layers, but we're going to also make sure we put a little bit more on the bony prominences, the malleoli, and also the heel area. It comes with 2 rolls, so this should be sufficient enough to cover the extremity pretty good. Go ahead and apply the padding on the extremity, make sure it's flush against the extremity, and that's 2 layers there. This is the way that can help you out instead of just go ahead and just rolling it up. You can take care of the bony prominence by adding the stirrups and keep on top of the position of the patient. So that's 1, and this is 2. Because this tear is really easy, you can go ahead and get the extra in the back and pull that up in a contour to the patient's extremity. Now I'm going to take care of the posterior heel. One, 2, and the part that's hanging down, go ahead and pull that off. The remaining portion of the padding, we're going to just roll up the extremity. When we roll this up, our goal is to go 50-50. Every revolution going around, we cover up half the width of the padding. You notice what I'm doing is tearing it a little bit as the circumference of the extremity starts to widen. Our goal is to make sure that this has smooth transitions so there's no possible pressure points. What I did, I finished that up with 3 layers up here just to cushion the back of the leg pretty good. Now what you want to do is make sure that there's not any hanging wrinkles. You pull that extra off. Any areas where you feel like it's light or not enough padding, you go ahead and just piece any areas that you need to make sure you need to pad a little bit better. Again, things that you want to make sure of is making sure the patient's in the proper position. Now we completed the padding. Now what we're going to use is our Delta-Lite conformable tape, which is fiberglass. Ensure you have a pair of gloves on because you don't want any of the resin to get on your hand. And also make sure the water temperature is cool, tepid, or room temperature when you apply. The instructor is going to actually tell you which size you want to use first. I'm using a 3-inch because what we're going to do is go around the foot, at the bottom of the foot. In order to activate this properly, depending on your level of experience, you're going to just dip the roll in the water. If you want to make it set up a lot faster, go ahead and dip it in the water and hold it underwater and squeeze it 2 or 3 times. That will ensure that the water is thoroughly throughout the whole roll. So dipping the roll in the water, ensure that the water totally saturates the roll. Some people like to say until the bubbles cease. Now you can apply this on the medial or the lateral side when you first start. And again, we're going around the rim of the foot. You're not pulling it hard, just enough till it conforms around the patient's extremity. And our goal is to roll this around the the rim of the foot twice. And as you notice, the roll is turned this way, not that way, as I apply it. And I'll demonstrate that later on. So as I go around the third time, as I approach the third time around, I go ahead and take care of the dorsal aspect of the foot and then the plantar aspect of the foot. As you notice, it's conforming to the patient's extremity. And then you start doing what we call 50-50 again, as like we performed with the padding. Ensure the patient's at 90 degrees just before you get ready to go above the ankle. Always end your roll on a wet portion of the roll and the same direction. Laminate, ensuring you push those layers together, which you just applied. Now what we're going to do is use a size 4-inch. We got little holes in the roll, in the package, so you can go ahead and pull it and open up quickly. You can change the setting time of this. You can squeeze underwater 2 or 3 times. That will speed up the exothermic reaction. Then gently squeeze coming out of the water. This second roll we're going to apply starting on the metatarsal pads. Go around there twice and start doing our 50-50. You don't have to worry about a figure 8 around the ankle because this conforms around the ankle really well. And then we start going up the longitudinal portion of the extremity, doing 50-50 or covering half the width with half the width as we go around. Notice the position of the roll. Now what I'm doing now is laminating, ensure those layers are pressed together. At this point, I'm going to apply the board to the plantar aspect of the foot. And my contact points are going to be the metatarsal pads and also the heel. So I grab the board and I apply it, ensuring I have total contact on the bottom aspect of the foot. Now it's important that the patient maintains their 90-degree angle. And there's one point I want to make sure we talk about is ensuring that the foot is not inverted or everted. Pay attention to the position as you apply it to board to make sure the foot is not turning inward or outward, or we call inversion or eversion. If you see any wrinkles on the posterior portion or the anterior portion of the ankle, go ahead and try to smooth those out. We don't want any wrinkles on the extremity. And as you can see on the plantar aspect, it's a flattened surface in this area here, the metatarsal pad area, and also on the heel. I'm going to apply another 4-inch roll. And again, I'm going to speed up the reactivation time by squeezing it in the water 2 or 3 times. And then when I pull it out, I gently squeeze it again to remove excess water. And you notice where I started. I want to make sure that I start a little bit, maybe an inch or 2 below where I finished, just so that the cure of the fiberglass is not directly where I stopped. Again, determine where your terminal points are of the cast. I'm going to finish it here. And ensure the patient stays at a 90-degree angle. This is at the critical portion where we want to make sure, and you see I'm pulling the padding down or the stockinette, and some of my fiberglass is hanging down, but I'll catch that in just a second. So next what I'm going to do is apply, the kit itself comes with 5 rolls, so that's more than adequate for any size patient. So there's no weight limitations for this type of total contact cast system. On this next roll, what I'll do is cover up this remaining portion up here and apply a little bit more on the heel. So as you can see, I'm wrapping this, ensuring that this area is padded on the posterior portion, because we want to make sure that the patient's at 90 degrees and it's not causing any discomfort. The cure time for this, that's just the cure time, but the set time is 5 to 8 minutes. So you have about that time to make sure that you take care of all the areas as fast as possible. So it'll be totally dry within 40 minutes. So my last roll, I'll go ahead and apply a little bit more on the heel and bottom portion of the foot, and I'll have the patient come down. If there's a wrinkle on the posterior portion while still setting, ensure that you rub that area out. Lower your foot down, there you go. Again, notice how I'm holding the roll. I am laminating the cast so that the cast material is solid. Now what I'm going to do next is allow the patient to come down. So go ahead and sir, put your foot in front, your other foot. Okay, go ahead and slide forward. There you go. Go ahead and stand up, sir. Don't put your weight on here yet. All right, good. Ensure the patient is standing straight up and their knee is flexed 5 to 10 degrees. Too much flexion will throw off the biomechanics of the patient, their standing position. Make sure they're not leaning left or right. And if they are unstable, they need to make sure that they either hold onto the table behind them or have an assistant maintain their position. The position of the knee should be slightly flexed, 5 to 10 degrees. Maintain that position for a good 30 to 45 seconds. And then after that, you tell the patient, go ahead and lean back to go and grab for the table and lift up this leg, sir, the leg that's going to be in the cast. And what we're looking for is that impression, the metatarsal pad area, and also the heel. This is where all the weight will be at. So after we complete that, we go ahead and apply the shoe. To apply the cast shoe, which it needs to be a rocker bottom, just go ahead and unstrap it. The shoe should be the length, at least the length of the foot. Put the cast shoe on your thigh. Put the patient inside the shoe. Strap it down tightly. Last, go ahead and walk on it. And you notice that his legs look normal or his knees look normal. When the patient gets ready to walk, ensure they have their other shoe on to kind of even out the height since they have the cast on plus the shoe. Now what I'm going to do is remove the cast, but before I start, I want some things I want you guys to notice as I get ready to take the cast off, some anatomical things that I'm trying to avoid. So on the lateral side is the lateral malleolus. So I'll just draw this so you can see what the goal is trying to avoid. And then on the medial side, I do the same thing. Now when you get ready to cut the cast off, you're going to start medial, midline of the leg, and we're going to cut in front or anterior to the malleolus. So I'll just draw a line. And when I get ready to cut this side compared to the lateral side, I'm going to cut posterior to it. Now in the front of the cast, where the toes are, just imagine if his toes were here. We're going to cut just a little bit beneath the toes. We intersect these lines when we cut. Do the same thing on the medial aspect. and that's where we're going to cut. Now let's talk about holding and using the cast saw. When we position the cast saw, we want to put this in between index finger and thumb web space equally. Now when we get ready to cut the cast, our goal is to either use the thumb to balance the cast so we can control the depth, or use our index finger to control the depth and just slide along. The finger does not need to be like this as we cut, because then we can't get down far enough. Our goal is to have that finger stretched out or the thumb stretched out. Now when I get ready to cut the cast off, the goal is to go in and out fairly quickly. Do not stay in there longer than 1 to 2 seconds. So it's in and out, in and out, in and out, in and out. Careful not to leave it in there too long, because it'll build up more friction or more heat, causing more discomfort for the patient. So when we get ready to start, I'll turn your leg this way for me if you could. We're going to either push the skin away or pull the cast away, just to do our first cut. Because this cast saw only cuts things that's resistant to it, it won't cut the stockinette as well, so that's why you want to pull the cast toward yourself to cut the cast that's underneath the padding. Okay? So when I do this first cut, I want you to see from here to here how I use my thumb, and then from here to here, I want you to notice how fast I go in and out. Make sure you tell the patient what some things they may feel, like they may feel a whole bunch of vibration. They may actually tickle the patient, but let them know. So what I'll do now is I'm going to turn the foot more in, just so you can see how far I'm going in and out, because what the goal is not to drag the cast saw, building up more friction. And always cut towards yourself, so it'll be better leverage as you cut. So now that we completed cutting the cast off, now it's time to make sure that we open it up totally with using the cast spreaders. And just a safety note, when you get ready to stop using the cast saw, make sure you turn it off and the blade is not moving at all prior to setting it down on something, so you won't rip or cut something. So these are the cast spreaders, and what we're going to do is just open up the cast in any area throughout the whole cast. And sometimes what it does is, if you didn't get something, it'll pop the rest of it open. And as you notice, as I go ahead and use the cast spreaders, I'm not digging inside the cast. I gently put them in through the little opening, and I spread the cast open. This ensures that you don't pinch your fingers by mistake trying to open it up. This is the most safest way to take care of trying to open up the cast. Next, all we're going to do is just go ahead, as you can see here, I'm going to cut all the way down to where the stockinette stops. So that's another note. We want to make sure the stockinette does not go so far down that we had to cut all the way down. And I do both sides. Now all I do is put the cast on my thigh, cut the rim of the stockinette. Just slide your scissors in between the little area. Now remember, as I said earlier, when I was putting the cast on the very beginning, I made sure that I covered the perforated foam. So now that the perforated foam is covered with the padding when I first did it, now as I take it off, it's not going to stick to the perforated foam. This way we cut the cast off, remove the cast without cutting along the bony prominences, avoided those prominent bony prominences, and now we can just go ahead and take out the rest of the cast material off. And I like to pull away from the extremity so that there's no way I can hit the skin. Again, this patient has neuropathy issues. You don't want any hot spots being developed or areas where a wound can start to develop. So what I like to do is go ahead and cut this to I totally can expose the toes. I can go ahead and take the cast off. And I just make sure I talk to the patient, make sure there was any discomfort at any point. The first cast is going to be removed after 48 to 72 hours. And I like to do is just feel inside the cast, make sure there's no wrinkles inside of it, and then check on the extremity if those wrinkles cause any problems. We just applied the Cutimed Off-Loader Select Total Contact Cast System. Just a few steps, you'll get more proficient, you will drastically shorten your application time, and ultimately take care of the patient to heal them a lot faster. Now, if you have any questions or concerns, please contact your nearest BSN rep. Thank you very much.